Tonight, on Legislative Review, a bill concerning Medicaid coverage for postpartum care. Plus, a contentious bill on automated voter registration gets Senate approval. You're watching Legislative Review. Thank you for watching Legislative Review. I'm Angela Nolasco with today's top discussions in the state legislature.
Consent of the House, the rules will be suspended, and Substitute House Bill 2041 will be advanced to third reading. Hearing no objection, so ordered.
State representatives debated a bill late Thursday that could change the length of time that new parents on Medicaid can access postpartum care. House Bill 2041, which drew starkly different views from both sides of the aisle, seeks to ensure that through June 2026, anyone approved for pregnancy or postpartum Medicaid coverage will continue to receive health care for a full 12 months after giving birth, regardless of income changes. But starting July 2026, that coverage window will be cut in half, down to just 6 months. Supporters say it's a necessary compromise to maintain extended care through the state's budget challenges. But those opposed to the reduction warn that cutting coverage puts lives at risk, and that behavioral health issues like postpartum depression and anxiety often appear around 5 months after birth, just as coverage would end under the new plan. Democratic Representative Nicole Macri sponsored the bill.
In 2022 or 2023, we were able to pass a bill that extends coverage for people at a higher income level and for a longer period of time when they're pregnant and after delivery for up to 12 months. And we applied to the federal government for a waiver in order to do that. The bill before us today will set a future date in which we will shorten that coverage for future enrollees. We will still cover folks up to 210% of the federal poverty line, but instead of extending that coverage for all of the pregnancy and 12 months after the pregnancy, the coverage will, the Apple Health coverage will cease after 6 months.
Speaking in opposition, Republican Representative Jim Walsh.
Of course, for people watching at home, Apple Health is our version in Washington of Medicaid, the hybrid federal-state health care plan policy program for people who qualify, generally poorer or disabled people. We are doing a number of things to affect Apple Health, the benefits available through Apple Health. And as we've discussed before on this floor about some of the other proposals, the net effect of what we're doing is diluting the pool of money and the resources available to people who need Apple Health, Medicaid for their health care. And Mr. Speaker, this is yet another example of the effects of that dilution. We are pulling resources into new directions and therefore pulling resources away from other benefits that we could offer through Apple Health. Why are we doing this, Mr. Speaker? Well, in part, because we're extending Apple Health benefits to illegal immigrants in Washington. And that is some of the push and pull going on for what is a limited amount of money in the Apple Health system.
The House voted on the bill.
The Speaker is about to lock the roll call machine. The Speaker has locked the roll call machine. Clerk will take a record.
Mr. Speaker, there are 56 yeas, 40 nays, 2 excused.
Having received a constitutional majority, Substitute House Bill 2041 is declared passed.
The bill now heads to the Senate for further review.
Senate Bill 5077, message from the House. The Secretary will read.
April 11th, Mr. President, the House passed Senate Bill number 5077 with the following amendments.
On Thursday afternoon, the Senate went over concurrences on several bills amended by the House. Among them, a contentious bill aiming to expand access to voter registration. Senate Bill 5077 seeks to give the governor and the Secretary of State authority to allow state, local, federal, or tribal agencies that already collect personal information to offer automatic voter registration or updates to existing registrations. That could include agencies handling public benefits, disability services, or even naturalization ceremonies, if they agree to participate. It would also allow the state's Healthplanfinder, which helps residents get health insurance, to share applicant data with election officials for automatic registration. but only if citizenship is verified and the applicant doesn't opt out within 15 days. This process would mirror how the Department of Licensing currently registers people who applied for enhanced IDs. Supporters believe it promotes inclusive democracy, especially for communities that might not interact with traditional voter registration points. Critics, however, are concerned about data privacy, federal compliance, and the potential for confusion or misregistration, especially when using health-related or correctional agency information. At a House floor debate last week, Republican Representative Jim Walsh spoke to oppose it.
I could tell you this is an issue of national significance, because it is. We are seeing these policies considered all around the country and at the federal level. And I think we need to look for what is emerging in some of those other places in terms of tools that we can use to improve our automatic voter registration here in our state.
The bill passed in the House along party lines with an amendment proposed by Walsh that was adopted and up for concurrence in the Senate. During Thursday's floor debate, Democratic Senator Javier Valdez, the bill's prime sponsor, spoke to concur with the amendment.
Again, the bill is about expanding voter registration services by certain government agencies. There was one change made by the other chamber on the other side of the rotunda. It removes the ability of third-party organization websites to host an application programming interface employed by the Secretary of State. Simple change, and ask for support on the and ask for concurrence.
The Senate took a floor vote on the bill's passage.
Mr. President, there are 30 ayes, 19 nays.
Having received the constitutional majority, Senate Bill 5077 is declared passed. The title of the bill will be the title of the act.
The bill passed along party lines and will need a governor's signature to be enacted. That's it for this episode of Legislative Review. Make sure to join us nightly at 8 and 11 for your highlights on the state legislature. And follow us on social media. Have a good night.